Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, we're talking about how St. Luke's research is changing patient care in Kansas City and beyond. I'm joined today by Dr. Mikhail Kasiborod, Vice President of Research at St. Luke's Health System. Thank you so much for joining us.
Thank you very much, Lindsay. Good to be with you.
St. Luke's is actively involved in more than 100 clinical trials aimed to improve patient care. And in recent years, St. Luke's researchers have published more than 250 studies annually in well-respected medical journals. This is one reason why St. Luke's Mid-America Heart Institute is ranked among the top 25 cardiovascular programs in the country. Well, first, Dr. Kasiborod, can you share how St. Luke's came to focus on clinical and outcomes research and why that's so important?
Well, thank you, Lindsay. I think that ultimately, in order for us to advance care, two things need to happen. First is that we need to generate evidence. We actually need to understand what works and what doesn't. And at the end of the day, probably the most critical part of that is, what we call clinical research. That's ultimately what happens at the bedside. So there could be wonderful developments at a bench, but then ultimately you need to translate them to understand whether they work in clinical practice. And that's where innovative research studies like clinical trials come in, right? So because you essentially do an experiment and you try to understand whether this device or medication or treatment strategy actually works and delivers better outcomes to patients. And then the other part is actually trying to understand what the end result of care truly is for patients. So that's where outcomes research comes in, which essentially says, look, whatever interventions we use, does it actually deliver better outcomes? Does it make patients live longer, stay out of the hospital, feel better, and really concentrate on meaningful outcomes, outcomes that are meaningful to patients, like how long they live, or if they're able to stay home and not be hospitalized, or they actually feel better or are able to do more from a physical function standpoint. So those are the types of outcomes that we normally focus on, rather than perhaps things may be less important for patients like laboratory tests. So, I think the way I would summarize it ultimately is the key is to develop evidence base so that we practice evidence-based medicine. We do what we believe works in clinical practice, and then actually measure what we do and continue to do kind of this rapid cycle of quality improvement to make sure that we deliver the best care for our patients so that they have the best outcomes.
What are some of the most significant advances by the St. Luke's research team?
Well, I think research has been a leader in clinical and outcomes research for a number of decades now, and it's especially relevant when it comes to cardiovascular disease in particular. So what are some of the kind of notable achievements that we've had over the years? I think it goes back to probably one of the things that St. Luke's Mid-America Heart Institute is especially known for, which is the first balloon angioplasty in the setting of acute myocardial infarction, setting of a heart attack. And I think that kind of sets us off on this, pioneer path, because you have to challenge conventional wisdom, and we've done that really well over the years. At the time, inflating a balloon in somebody's heart artery at the time they're having a heart attack was considered to be kind of a crazy thing to do. Contraindication, of course, what we proved ultimately is that that's the one clinical scenario where angioplasty or inflating a balloon inside the artery is actually life-saving. And of course, that has continued over the years. So we, for example, were the first institution in the Midwest to do a transcatheter valve implantation. So it's actually replacing somebody's heart valve without having to do open heart surgery. Those procedures are now commonplace, but we're the first to actually do it in this part of the country. That's a piece which I think is also a huge milestone in our history as a clinical research institution, is development of tools to measure patient-centered outcomes, and specifically what patients report, their symptoms, function, quality of life, something we call health status. That's now, again, commonly accepted as something we should measure in clinical practice, what we should measure in clinical trials to understand what works and what doesn't. But a few decades ago, nobody even knew what that was. So we really advanced the field in a dramatic way by doing that.
And what are some of the most recent advances?
Well, again, I think it spans both medications and devices and actually strategies of care. So on the device side, for example, we are one of the institutions advancing this kind of a novel procedure, not just for the valve replacement, but also to try to reduce a valve leak in one of the main valves in the heart called the mitral valve, using this device called MitraClip. One of the huge developments in the world of heart failure, for example, more recently has been studying a medication that was initially, a class of medicines that was initially developed for diabetes called sodium glucose cotransporter 2, or SGLT2 inhibitors, and actually proposing that they may not just be medications for diabetes, but also actually treat heart failure. And we, in fact, started one of the first trials worldwide to look at that, and now it's been proven to actually prolong life, reduce hospitalizations, improve quality of life in patients with heart failure. It's going to become a standard of care for heart failure patients worldwide. So these are really great advances both in device and medication world. And then lastly, but not least, is really just thinking how we deliver care at all. In other words, how do we take these advances, how do we incorporate in the care of patients? Because at the end of the day, if you do a clinical trial and produce a wonderful piece of evidence, but it doesn't get used in clinical practice, you haven't really achieved much. So what we've actually done is also lead on a way that these novel advances in care actually get incorporated in clinical practice. In the world of cardiometabolic disease, which is kind of this intersection of diabetes and heart disease and kidney disease, we started this very novel care delivery model called Cardiometabolic Center of Excellence at St. Luke's, and now it's become kind of a national organization where we help others develop it, where patients with diabetes at high risk or with established heart and kidney disease can get comprehensive team-based care.
That's great. So how does the research being done here at St. Luke's fit into the national landscape?
I think we've really had a stratospheric rise, frankly, in how big of an impact we've been having over the past few years. Again, we have rich history, but if you look at the trajectory where we're going, it's really exciting. If we look just at the number and impact of presentations on national, international stage and research studies that we've been publishing on a yearly or annual basis, it's incredibly impressive. We're getting close to 300 a year now, which is amazing productivity. But again, it's not just the numbers that matters, it's the impact as well. Just to give you an example of a very recent development, so American College of Cardiology scientific sessions, we had a total of 37 presentations at the ACC. And again, it's not just the number, it's the impact as well. So we have two, actually, presentations at this meeting, which are late-breaking or featured clinical trials. So these are really the research studies that are going to probably make immediate and biggest impact on clinical care. One of them actually has to do with a novel medication for the most common congenital or genetic, rather, heart disease called hypertrophic cardiomyopathy, with a medication that may develop really substantial benefits, a big breakthrough, the first in many, many years of trying to find out treatments for this disease. The other one has to do with testing one of the medicines that actually are used for diabetes and heart failure to try to understand could they actually be beneficial in the setting of COVID-19 and are they safe in that setting. So again, both of these studies will likely have some impact either immediately or within the very near future on patient care. So I think all in all, both the breadth and the impact of what we're doing has substantially expanded and continues to expand. I think it's very important to keep in mind that this doesn't happen in a vacuum. In order to be able to do that, we really need to invest and grow our infrastructure, and that's really been a concerted effort, and frankly, it's a strategic plan for our future continuing success is to continue to invest in the research infrastructure so we can continue to do wonderful things like the ones I just described.
Well, that's great. So what drives the St. Luke's research team?
I think ultimately it's improving the lives of patients. That's ultimately the true north, I think, for all of us that are involved in clinical research at St. Luke's. It's asking what can we do to really impact those important patient outcomes I mentioned before, which is, trying to keep our patients living longer out of the hospital and feeling better and have more fulfilling life with better quality of life. That's ultimately what's always been in our DNA, is to do what actually matters. And I think as long as we keep that in our kind of a field of vision, we'll continue to evolve and succeed and get bigger and better, which is the plan.
Great. Well, thank you so much for joining us today.
My pleasure. Good to be with you.
If you'd like to find out more about how St. Luke's is advancing cardiovascular care through leading-edge research, visit stlukeskc.org/2021ACC. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.